So my name is Dr Soma Bandershee and I'm a consultant in stroke medicine at Imperial College Healthcare NHS Trust. So this paper, the purpose was to provide an update into the benefits of stem cell therapy in stroke medicine. Stroke is a major cause of mortality and morbidity across the world. We know that it is the second commonest single cause of death worldwide and also the commonest cause of adult disability across the globe. Stroke, at a very basic level, is where you have an interruption of the blood supply to the brain, which then causes irreversible damage to that part of the brain. There are two different types of stroke. 80% are ischemic, that's where you have a blockage to the blood supply to that particular part of the brain. And it is in that situation where if you can dissolve the clot that caused the blockage, you can potentially completely reverse or partially reverse the effects of the stroke. 20% of all strokes are hemorrhagic. That means where bleeding has occurred in that part of the brain. A common reason for that, for example, would be high blood pressure. The commonest thought reason for how stem cells work is that you put a stem cell into the damaged area and then it regrows that part of that organ, whichever organ it is. In terms of the brain and stroke, there's very little evidence that that's how stem cells work, that they go and regenerate brain. There is more evidence that stem cells are working indirectly by perhaps inducing different factors to be produced, different trophic factors, which may increase, for example, blood vessel formation, which is key to recovery from a stroke, or may induce neuron formation, which is part of the brain tissue. So if you can induce the formation or the repair of the brain, then that may well be one of the ways in which stem cells are working. We conducted here at Imperial College, and that's with my colleagues and principal investigators, we've conducted the UK's first stem cell trial for acute stroke patients. So that is looking at patients with severe stroke within 7 days of the onset of their symptoms. So there is evidence for lots of different types of stem cells given to induced stroke models, so animals at different times after a stroke, and given to animals via different methods of delivery, for example direct implantation, intracerebral implantation, or given systemically such as intravenously or intraarterially. So all of those different things have been shown to work in different trials. The challenge now is translating that to the clinical arena and deciding which is the best type of stem cell to use, when should we be giving it to our patients after a stroke, how should we give it to our patients, amongst a number of other controversies which we discuss in the paper. I think there is certainly a future role for them. I think we are still quite a long way away from it being a realistic treatment that we are using day to day, but the hope would be that as we develop our knowledge from the preclinical as well as the clinical arena, that we can develop, for example, stem cells for off-the-shelf use. So you'd be able to have stem cells available very much like you have any drug or treatment available when a patient comes in, and perhaps you will use different types of stem cell products for different types of strokes and different types of patients. But we're still quite a long way away from being able to do that.